So you have a couple instances that you decide that you want to go see your doctor. One of those is you randomly drop and shatter your coffee cup. Another one is that you began to trip over your own 2 feet. You're feeling like there's a lot of fatigue and things in your arms, and you've also begun to notice muscle twitching. And this has brought you to your doctor, and your doctor decided to run some tests on you. When he gets your diagnosis back, he gives it to you, and it's ALS. He explains that ALS is a neurodegenerative disease that is terminal, one which you slowly lose the pathways of the connections between your brain and the muscles. So in the beginning, it's going to be smaller things like dropping coffee cups, forgetting, not being able to talk, slurred speech, things like that. And as it progresses, it'll get a little bit more serious. You're going to have problems swallowing. This can cause a choking hazard. You also will lose the ability to breathe on your own. So there are treatments to help you to cope, but there is no cure for ALS. The worst part is that your cognitive abilities are fully intact. So when you're laying there not able to breathe and you're eating through a feeding tube, your mind is completely lucid. And at some point you will become a vegetable in the bed, and your family will have to go through possibly years of watching you slowly die because machines are actually keeping you alive. So many of us have either known somebody or have experienced watching somebody die slowly. And this can negatively have a negative effect on everyone that is involved. This is where physician-assisted suicide can help alleviate the pain and suffering for not only the patient, but for the family also. Today I want to cover the reasons why I believe physician-assisted suicide for terminally ill patients should be legal in all 50 states, including some points on what a terminal illness is it considered ethical, autonomy of the patient, and dying with dignity. So to begin, I just want to explain what a terminal illness is. Terminal illness is defined as a disease that cannot be cured or adequately treated, and is reasonably expected for the result of the patient to end in death. This is where all options have been exhausted and death is imminent for this patient. So one of the most asked questions is physician-assisted suicide ethical? Physicians take the Hippocratic Oath. In the 1967 writing, The Hippocratic Oath, Text, Translation, and Interpretation, Ludwig Elstein explains that the entire Hippocratic Oath encompasses everything that we understand as do no harm. So in book 1, section 11.5, it states, quote, practice 2 things in your dealing with disease: either help or do no harm to the patient. So with that being said, we have to understand what is harm. Your definition of harm and my definition of harm may be 2 different things. And that's why harm should technically just be defined individually by the patient. The patient should be able to say, this is what I consider harm to me. So with that being said, we have to bring in autonomy. So autonomy is something that is granted to all coherent, lucid patients. Autonomy is defined by the National Library of Medicine. It is the patient's right to make decisions about their medical care without influence from medical professionals. So it's the physician's job, and it's their responsibility to fully inform the patient of all options for treatment or lack of treatment, and what effects both of those options will have on the patient. So once the physician has informed the patient, it's up to the patient to decide and determine to what extent they want to have treatment, if they want to have any. So this is where harm is included in the patient's decision. If the patient has made a decision to end their life through the physician-assisted suicide, and the physician agrees to do it, it should legally be allowed. One can even say that the patient asking to have it done and the government or the federal government refusing to have it done could be considered treatment inhumanely upon the patient. We euthanize animals all the time because life quality has decreased due to medical issues, so why would we force a human to suffer through their death? Which brings us to passing with dignity. Yale University did a survey, and it asked patients if given the choice where you would prefer to die. The majority of them said they would prefer to die at home. They also stated they would prefer a peaceful, painless death at home with dignity and a sense of emotional well-being and a control over how people remember them. For many, passing in your home, surrounded by the comfort of your house and your loved ones, and the support that you get from is far superior from passing away in a cold, desolate hospital room. Choosing to not have your spouse or your children watching you wither away, or gasping for air, or moaning inconsolably in pain are options that we're all afforded when we're considering physician-assisted suicide. So today we looked at physician-assisted suicide for terminal patients with terminal illnesses. We covered what a terminal illness was, whether it's considered ethical, the patient's choice in their health care treatments, and allowing patients to die with dignity. So as humans, we have a choice in everything that we do, and dying should be no different. I couldn't fathom laying in bed with my muscles paralyzed, being fed through a tube, and a machine breathing for me, and all the while my mind is clear and lucid. I understand everything that's going on around me. Spending every hour of every day laying there, for me, I would consider torture and harmful to my well-being. I feel that patients with terminal illnesses should be allowed to have the option of physician-assisted suicide, and it should be an option in all 50 states. So allowing them the autonomy to make those choices for themselves, and allowing them to be able to die with dignity.